Welcome, doctors. I will talking about head injuries in this section. Our brain is covered with multiple layers. The layers of our head, which are scalp, then skull, then meninges. And this meninges formed of three layers from outer to inner, dura mater, then arachnoid, then pia mater. Types of head injuries: scalp injuries, skull fractures, meningeal injuries, which are subdural hemorrhage, extradural hemorrhage, and subarachnoidal hemorrhage, then cerebral injuries, which are concussion, compression, or brain laceration. In our section, we will talk about skull injuries. Mechanism of skull fracture. There is a cranium, which is a skull, and object, which making the fracture. When a forcible impact like this hammer strikes the cranium or the skull, what occurs? The area under the impact point, or under the force of the hammer, bending inwards or making intrusion, and both sides of the skull are bulging or making extrusion, and this process defined as struck hole. This is the site of intrusion, making deformity in the shape of the skull, like this picture. Force making bending of the skull inwards and bulging of the skull on both sides of the force, making this fracture. Types of skull fracture. Types of skull fractures according to the instrument: blunt instrument or sharp instrument. The skull fracture occurs in the form of linear skull fracture or in the form of depressed skull fracture, in which area or part of skull is depressed inwards. First, head injuries caused by blunt instrument. Number 1, fissure fracture. Fissure fracture is caused by blunt instrument with low force and characterized by it is linear fracture with no bony defects. It is simply fissure in the skull bone, like this cup. There is fissures in this glass without complete fracture in it. Fissure fracture divided according to the site into vault fracture occurs in the vault of skull and base fracture occurs in the base of skull, which is formed of three fossa, which are anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. This is vault fissure fracture, and this is skull base, which is formed of three parts: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. This is fissure fracture occurring at vault of skull. This is shape of fissure fracture in X-ray, appearing in the form of line in the skull, linear or fissure fracture. And here it is CT scan showing shape of fissure fracture in the form of line. So again, fractures caused by blunt instrument with wide striking surface area. With low force, it is fissure fracture caused by blunt instrument with low force. Number 2 is depressed fracture. Depressed fracture also caused by blunt instrument, but there is two types of depressed fracture. First is localized depressed fracture, in which the instrument is small or localized. Number 2 is depressed comminuted fracture, which is caused by wide striking surface area or wide blunt instrument. First is localized depressed fracture, which is caused by blunt instrument with localized striking surface area, and the force may be low, moderate, or severe. Okay, this is blunt instrument, hammer, making depressed fracture with its head. This localized depressed fracture caused by blunt instrument with localized striking surface area. The force may be low, causing localized depressed fracture, or moderate force causing localized depressed fracture with partial comminution, or with high force causing localized depressed fracture with complete comminution. Meaning of comminution is loss of bone, complete loss of bone, making localized depressed fracture with complete comminution. Partial loss of bone causing localized depressed fracture with partial comminution. This is localized depressed fracture with low force, no comminution. Bone is present in its site, no comminution of bone, so it is localized depressed fracture only caused by low force of localized striking surface area. Also, this is localized depressed fracture with no comminution, meaning no loss of bone, so it is localized depressed fracture caused by blunt instrument with small striking surface area with low force. Also, it is localized depressed fracture, NCT. So, fracture caused by blunt instrument with localized striking surface area. First type is localized depressed fracture caused by low force. Localized depressed fracture with partial comminution, like this picture, there is a loss of bone partially, partial loss of bone. So it is defined as localized depressed fracture with partial comminution. This is CT picture showing localized depressed fracture with partial comminution. Here there is partial loss of bone, partial loss of bone. This type of fracture is caused by localized striking surface area of blunt instrument with moderate force. Also, it is localized depressed fracture with partial comminution. It is CT picture. So again, fracture caused by blunt instrument with localized striking surface area with moderate force is localized depressed fracture with partial comminution. And here, fracture caused by blunt instrument with localized striking surface area and high force, defined as localized depressed fracture with complete comminution, like this picture. There is complete loss of bone in the site of fracture. This is the shape of localized depressed fracture with complete comminution in CT scan. Also, this is the shape of localized depressed fracture with complete comminution in CT scan. So, depressed localized fracture or localized depressed fracture may be depressed localized fracture with no comminution caused by low force, or depressed localized fracture with partial comminution. There is partial loss of bone like this picture, or depressed localized fracture with complete comminution with complete loss of bone like this picture and caused by high force. Second type is depressed comminuted fracture, which is caused by wide striking surface area, like car accident or falling from height. This is the shape of depressed comminuted fracture. There is loss of a large part of bone, caused by striking in a wide striking surface area. This is the shape of depressed comminuted fracture, complete loss of large part of skull. This is CT scan showing the shape of depressed comminuted fracture, which is caused by what? Wide striking surface area. So again, fracture caused by blunt instrument and wide striking surface area and high force defined what? Depressed comminuted fracture. Second part of our section is head injuries caused by sharp instrument. Sharp instrument is the instrument having sharp edge, like axe or knife, making what? Making a fracture according to direction, may be perpendicular or tangential. So skull fracture caused by sharp instrument divided according to the direction of instrument, may be tangential direction, making what's called shaped fracture, or vertical direction, meaning perpendicular on the head, making what? Making fracture, named as cut fracture or cut comminuted fracture. These types, cut or cut comminuted, divided according to the force. If low force, making cut fracture. If high force, making cut comminuted fracture. And comminuted fracture, meaning loss of bone. This is the shape of skull fracture caused by sharp instrument passing tangentially, making what? Making shaped fracture, like this picture, loss in the outer table only of the skull. But if the instrument passing vertically or perpendicular, making what? Making cut fracture, like this picture, or making cut comminuted fracture, like this picture. There is loss of bone, and the edges is sharp, cut, but with loss of bone, so it is named as cut comminuted fracture. So, skull fracture caused by sharp instrument, again, according to direction, may be tangential causing shift fracture or vertical causing cut fracture or cut comminuted fracture. There are factors affecting the shape of skull fracture. These factors related to the object or to the cranium or the skull. These factors are first related to the object, force or momentum, and this force may be low force, moderate force, or high force. Or striking surface area, which may be localized or wide striking surface area. Making what? Localized striking surface area, making localized depressed fracture. And wide striking surface area, making what? Making depressed comminuted fracture or fissure fracture. Factors related to the head may be position of the head, if the head is supported or not. Supported making small, large fracture, but if not supported, making small fracture. Also site of flow. If the bone is thin bone like temporal bone, making what? Making large fracture. Also elasticity of bone. If the bone is elastic or not. If the bone is elastic, making small fracture, but if the bone is not elastic, making large fracture. Healing of skull fractures. Healing of skull fractures occur in the form smoothing of the edges, and it takes 3 weeks. Then formation of fibrous membrane, and this takes 6 to 12 months. This is the shape of smoothing of edges, which takes 3 weeks to occur. In this picture to the left, showing smoothing of edges, which is the first sign of healing, and this picture to the right, showing formation of fibrous membrane. Meningeal injuries. Meninges formed of 3 layers: dura mater under the skull, then arachnoid, then pia mater on the brain substance. There is types of meningeal injuries in the form of hemorrhage, and this hemorrhage may be epidural or extradural hemorrhage or subdural hemorrhage. Extradural hemorrhage occurs outer to the dura mater, so it occurs between the skull and the dura, forming hemorrhage in the form of lens shape or biconvex hemorrhage. But subdural hematoma occurs between the dura and arachnoid, the second layer of meninges, and occur in the form of thin film of blood on the brain substance. This is the shape of extradural hematoma, lens shape or biconvex shape, between the skull and the dura, occurs due to fissure fracture like this or another types of fracture, making rupture in the middle meningeal artery mainly. This is the shape of extradural or epidural hemorrhage in the form of convex-shaped hemorrhage. This picture on the left is CT scan showing shape of extradural hematoma or hemorrhage biconvex, and this picture to the right is a jar containing part of skull showing shape of extradural hematoma in the form of biconvex shape. This is extradural hematoma in CT scan. Again, the difference between extradural or epidural hematoma and subdural hematoma. Extradural hematoma occurs outer to the dura, between skull and dura, making biconvex shape. But subdural hematoma occurs under the dura, between dura and arachnoid, making thin layer of bleeding on brain substance. This is the shape of subdural hematoma. To the left is CT scan showing the shape of subdural hematoma. It is a white shadow covering the brain substance, thin layer covering the brain substance. And to the right, there is two pictures showing the shape of subdural hematoma under dura, thin layer of blood under dura. Also, it is picture for subdural hematoma in CT scan. And this also subdural hematoma. Surgical intervention, and it will be done in the presence of compression of brain. We do surgical intervention to making decompression of brain to remove this compression, which may be caused by hemorrhage of brain, hemorrhage which may be extradural hemorrhage or subdural hemorrhage. Surgical intervention may be through trephine, like this picture to the left, making hole like this, or in the form of nippling and trephine, like this picture to the right. Trephine is a small hole by some instrument, and the nippling making widening of this trephine. Like this skull, showing fracture in the skull with two trephine, defined by these arrows. Also, it is a trephine, this arrow defining it. This is a trephine, and this skull showing three arrows defining multiple trephines in this skull. Causes of death in head injuries. Brain injuries may be concussion or compression or brain contusion or brain laceration or intracerebral hemorrhage. What is causes of this important in our sections are concussion or brain compression. So causes of this in head injuries may be immediately or shortly after the injury in short time due to concussion or compression or brain laceration, and may be delayed, meaning after long time after injury due to intracranial sepsis or infection or epilepsy. If there is extradural hemorrhage or surgical interference, no concussion in cause of this, only compression and brain laceration. When we say delayed causes of death, yes, if there is signs of healing in the form of smoothing of edges, or membrane formation, because the signs of healing taking long time, 3 weeks or months. Signs of skull fracture may occur in these parts of skull: may frontal bone, parietal bone, temporal or occipital, or facial bone, which is sphenoid, ethmoid, nasal, zygomatic, maxilla, or mandible. Skull fracture may occur with association of other fissure fractures named as radiating fissure fracture, like this. This is skull fracture, which is localized depressed fracture, this circle showing it, with some radiating fissure fractures surrounding this main fracture. How to comment on head injuries slides. To write a comment on skull specimen or head injuries slides, we must cover the following items: type of specimen, sex and age if possible, lesion or fracture, and the positive instrument, type of the instrument and the force. And lastly, cause of this, which may be immediate or delayed. Type of specimen may be complete skull or piece of bone of skull or skull bone. To make comment on lesion or fracture, we must cover 6 points. 2 points are important, which are type of fracture and its site. And 4 may be present or not. May be present accompanied radiating fissure fracture, meningeal hemorrhage, signs of healing or sepsis, or signs of surgical interference in the form of nippling or terrifying. At the point of cause of this. Cause of this depends on presence of signs of healing or sepsis. If these signs of healing or sepsis present, so the cause of this is delayed cause of this. If not present, so the cause of this is early causes of this. What is the delayed causes of this? Is abscess or sepsis, brain sepsis or abscess, or epilepsy. What is early causes of this? Is concussion, compression, or brain laceration. These signs of healing or sepsis, if not present, so the cause of this is early causes. If the specimen is jar, so this early causes of this is compression only. If there is evidence of hemorrhage in the form of dural splitting, in the form of extradural hematoma, or presence of terrify or nippling, so the cause of this may be compression or brain laceration. If there is fracture, cut or ship fracture, so the cause of this may be concussion or compression. If there is firearm injury, so the cause of this is brain laceration. If not any, not jar, no evidence of hemorrhage, not cut fracture or ship fracture, and not firearm injury, we write 3 causes of this: concussion, compression, or brain laceration. Comment on CT scan. At comment on CT scan, we do comment on skull injury and meningeal injury. Skull injury may be fissure fracture or depressed fracture, and this depressed fracture may be localized depressed fracture or depressed comminuted fracture. Second point is meningeal injury, and this meningeal injury may be extradural hemorrhage or subdural hemorrhage. Like this. This is a CT scan showing what? Showing only fissure fractures, no other signs, only fissure fracture in the skull. Also, this is a CT scan showing what? Showing a fracture. What is the type of this fracture? It is localized depressed fracture. Yes. And this CT scan showing what? Showing depressed comminuted fracture. This is a CT scan showing what? Showing localized depressed fracture. And here there is CT scan showing what? Showing localized depressed fracture with complete comminution, which is caused by what? Caused by blunt instrument with localized striking surface area and high momentum or high force. Also, here there is CT scan showing localized depressed structure with complete comminution. Also, this is the same. Localized depressed fracture with complete comminution. Here, this picture to the left showing CT scan on the brain, showing shadow, white shadow taking shape by convex or lens shape, which defined as extradural hematoma or extradural hemorrhage. Also, it is extradural hemorrhage, taking the shape of biconvex hematoma or lens shape between the skull and the dura. This is the same, extradural hemorrhage. In this CT scan to the left side, there is subdural hemorrhage, which appeared as thin layer of bleeding taking shadow white shadow on the brain substance. This is its shape, thin film on the brain substance, subdural hemorrhage. This is the same subdural hemorrhage. So, extradural hemorrhage taking the shape of lens shape biconvex, but subdural hemorrhage taking the shape of thin film, thin layer on the brain substance. Comments on our specimen. First one to the left is vault of skull showing localized depressed comminuted fracture in the right fronto-parietal bone with two radiating fissure fracture. Specimen is vault of skull. Lesion is localized depressed comminuted fracture in the right fronto-parietal bone with two radiating fissure fractures. Positive instrument here is heavy blunt instrument with localized striking surface area and high momentum. And the possible cause of this may be concussion, compression, or brain laceration. This to the right, this picture to the right is part of a skull vault, showing what? Showing depressed comminuted fracture with extradural hematoma. So the specimen is part of skull with dura mater. Lesion is comminuted fracture with extradural hematoma, appearing in the form of separation of dura from bone. This is evidence of surgical interference in the form of nibbling. There is a nibbling. Nibbling in the edges of the skull fracture. Positive instrument here is heavy blunt instrument with wide striking surface area and high momentum. Possible cause of this may be compression or brain laceration. In this specimen, comment is vault of skull showing localized depressed comminuted fracture with signs of healing in the form of smoothing of edges in the left parietal bone. Specimen is vault of skull. Lesion is localized depressed comminuted fracture with signs of healing, and positive instrument is heavy blunt instrument with localized striking surface area and high momentum. Cause of this here may be brain abscess or epilepsy. Late causes of this due to presence of what? Signs of healing in the form of smoothing of edges. This is a vault of skull showing cut comminuted fracture with radiating fissure fracture, trifine, and nibbling. First item of our comment is specimen, which is vault of skull. Lesion is cut comminuted fracture extending in both parietal bones crossing the sagittal suture with trifine and nibbling. There are also two radiating fissure fracture. What is the causative instrument is sharp instrument, and possible cause of this may be compression or brain laceration. Our comment here is vault of skull showing cut comminuted fracture with two radiating fissure fractures in the left parietal bone. Specimen is vault of skull. Lesion is cut comminuted fracture with two radiating fissure fractures in left parietal bone. Positive instrument is heavy sharp instrument, and possible cause of this is concussion, compression, or brain laceration. Comment here is vault of a skull showing multiple cut fractures with radiating fissure fractures in the parietal and occipital bones. Two cut comminuted fractures with radiating fissure fractures in the right parietal bone. Our specimen is vault of a skull and lesion, two lesions. First one is multiple cut fractures with radiating fissure fractures in the parietal bone and occipital bone, which is number 1. And second, two cut comminuted fractures with radiating fissure fractures in right parietal bone, numbered here 2. Positive instrument is sharp instrument, and possible cause of this concussion, compression, or brain laceration. Comment here is CT scan showing what? Showing subdural hematoma taking shape of thin film covering the brain substance lying between dura and arachidona. Finally, thank you.